If your jaw feels tight or locks up, it might not be dental. You think it's stress or your teeth, but jaw tightness like this could actually start in your brain. Most people don't think twice when their jaw feels tense or stiff. Maybe it's from grinding your teeth at night. Maybe it's your posture. Maybe it's just stress. And a lot of the time, it is. But what if the tightness won't go away? What if it's showing up on just one side? What if it's not responding to any of the usual fixes, like mouth guards, massages, or jaw exercises? That's when it's worth asking a different question. Because in some cases, jaw tightness, locking, or muscle stiffness can be linked to neurological changes. In fact, some people experience these kinds of symptoms before they show more common warning signs, like tremors, memory issues, or trouble with balance. In this video, we're going to explore the surprising connection between jaw stiffness and brain function, and what your body might be trying to tell you when your dentist can't find anything wrong. So how could something like jaw tightness be connected to your brain? It starts with a group of muscles called the muscles of mastication, the ones that help you chew, clench, and move your jaw. These muscles are controlled by cranial nerves, which carry signals directly from your brain to your face. When those signals become disrupted, even slightly, the result can be a jaw that locks, stiffens, or feels like it's fighting to move. One possible cause is something called oromandibular dystonia, a condition where the jaw muscles tighten involuntarily. It's rare, but it's often linked to neurological changes, including those seen in Parkinson's disease, multiple system atrophy, and brainstem stress. In fact, some people report jaw stiffness or jaw clenching months or years before they ever develop a tremor or other motor symptoms. Another lesser-known cause is central sensitization, when the brain begins to misinterpret pain and tension signals in the body. This can cause the jaw muscles to stay tight, even when there's no injury, no inflammation, and nothing wrong with the joint itself. You might also notice jaw tightness that comes and goes, especially during times of fatigue, stress, or after poor sleep. That's often because your brain is struggling to regulate muscle tone consistently, a sign of autonomic dysfunction or neuromuscular fatigue. The key detail here is asymmetry. If the tension is always worse on one side, or if one side of your face feels heavier, tighter, or slower than the other, that may point to unilateral nerve disruption. And that kind of imbalance is often a red flag for early neurological issues. This doesn't mean every case of jaw pain is a brain warning. In fact, most aren't. But when it comes on without dental problems, doesn't go away with standard treatment, and especially if it shows up with other subtle symptoms, like hand weakness, facial tension, or coordination issues, that's when it becomes worth a closer look. Next, we'll cover the most common red flags to watch for, and what to do if your jaw is giving you signals your dentist can't explain. If you're finding this helpful, hit like and subscribe to stay updated with more science-backed health tips. So how do you know if your jaw tension is just everyday stress or a subtle sign of something deeper? Start by asking yourself a few honest questions. Asterisk, has your jaw been locking, clicking, or tightening without any clear dental reason? Asterisk, is the tightness always worse on one side? Asterisk, have you tried mouth guards, posture changes, or stress relief, and it's still there? Are you also noticing small changes elsewhere in your body, like tremors, fatigue, or weakness? If any of those feel familiar, it might be time to look at the bigger picture. Let's be clear, most jaw pain is not dangerous. Stress, poor posture, sleep habits, or grinding can all trigger tension. And sometimes that's all it is, but not always. In some cases, persistent jaw stiffness, especially when it's unexplained and one-sided, can point to neurological issues. These issues don't always arrive with dramatic symptoms. Sometimes they whisper their way in through tight muscles, poor coordination, or uneven movement. Here are a few red flags to pay attention to. Jaw tightness that won't improve over time, even with treatment. One side of the jaw feeling heavier, stiffer, or slower. Jaw clenching that gets worse with mental fatigue or stress. Difficulty fully opening or closing your mouth. Episodes where the jaw seems to freeze briefly. Facial twitching or tremors that accompany the tightness. Uneven tension between the left and right sides of your face. These signs could point to early stages of oromandibular dystonia, a rare but real condition where the jaw muscles receive confused signals from the brain. In other cases, it could be part of the early motor symptom spectrum seen in Parkinson's disease, MS, or even small vessel strokes that affect facial control. You might also experience changes in muscle tone, speech control, or even eye tension, all of which tie back to how the brain manages facial and jaw movement through cranial nerves. So what can you do? First, track the pattern. Keep a note on when the tightness appears. Is it random, or does it follow a rhythm, like fatigue, stress, or time of day? Second, watch for clustering. If jaw tightness is showing up with other subtle symptoms, like reduced grip strength, tremors, dizziness, or facial asymmetry, that's worth taking seriously. Third, talk to a professional. If your dentist finds nothing wrong, ask for a referral to a neurologist or a movement disorder specialist. Even a basic screening can help rule things out or catch something early. And finally, trust yourself. This isn't about panic, it's about awareness. You're not overreacting by noticing something that doesn't feel right. You're being proactive. Because sometimes the quietest signals, like a tight jaw, are the ones that matter most. And listening early gives you more power, more clarity, and more time to take action. Thank you for watching. Stay healthy, stay curious, and I see you in the next one.